Hello and welcome to this lecture of novel coronavirus SARS-CoV-2, in which we will be discussing some major terms and terminologies which have suddenly erupted from years old history because of this COVID-19. Restricting movement of people to prevent the spread of disease has been used for thousands of years, long before the cause of infectious diseases was understood. The word quarantine derived from the 40 days used to try and prevent spread of the Black Death in the 14th century. By the way, what's so special about this number 40? Okay, so historically, a quarantine referred to a period originally of 40 days imposed upon ships when suspected of carrying an infectious or contagious disease. This practice was done in Venice in the 1300s in an effort to stave off the plague. Ships were routinely quarantined to prevent the spread of infections, including cholera. So now, let's also discuss the terms related to it as well. Quarantining means people are put in quarantine when they are not currently sick, but have been or may have been exposed to a communicable disease. This can help to stop the spread of the disease. Voluntary quarantine, when someone is not ordered to go into quarantine but chooses to do so just out of caution. It is often called self-quarantine. Isolation. Isolation happens when a person is infected with a communicable disease and is separated from people who are healthy. This also helps stop the spread of the disease. Voluntary isolation is sometimes called self-isolation, although everyday people using the latter term may not mean they are actually infected. It was first recorded around 1825 to 1835. Isolation ultimately comes from the same root as insulation. Also, there is an important aspect which we need to understand, and that is the difference between social distancing and physical distancing. Although both of them are similar concepts and are intertwined with each other, but in the context of mental well-being, we need to appreciate the use of physical distancing over social distancing. It seems that this is an unfair or inappropriate choice or use of words when we say social distancing, while we meant to use physical distancing. Social distancing appears to stop or limit social interaction with the loved ones, while in the age of advanced technology, we can be connected with our loved ones without being physically connected to each other. So yeah, I would really appreciate to use physical distancing over social distancing. The scale of the quarantine restrictions in China is unprecedented. In this step, we will look at the science behind quarantine. There is always a period of time between acquiring an infection and beginning to show symptoms. That period is known as the incubation period. There is a characteristic incubation period for each disease. There is always variation between people, so each disease has a characteristic median, minimum, and maximum incubation period. The distribution of incubation periods is usually rough, as shown here, rising quickly to a peak with a long right tail. So now, the question is, how do we calculate the incubation period of COVID-19? For some diseases, the incubation period is shorter after a larger infecting dose. Because COVID-19 is new and novel, we did not initially know the incubation period. It was estimated from direct observation of people with COVID-19 with known dates of exposure, and from travelers from Wuhan, as we knew the last possible date of exposure, together with modes of the likely distribution of incubation periods based on the typical shape and comparison with what was known for SARS from 2003. This gave a median of 6 days with a range of 2 to 14 days. This tells us how long we would need to wait to know someone is going to develop COVID-19 after exposure, and forms the basis for the duration of quarantine for travelers. But another important consideration is, when is someone infectious? Remember, the incubation period is the time between acquiring an infection and beginning to show symptoms. There is also a period of time between acquiring an infection and becoming infectious. That is, when you can transmit it to someone else. A key question was, at what point someone with COVID-19 becomes infectious? Was it only after developing symptoms like in SARS, or could they transmit before developing symptoms? Studies in Germany and in China have shown that people whose only contact with COVID-19 was with patients during the incubation period can get the disease. So, transmission can happen during the incubation period as well. Transmission can certainly happen from those with symptoms, and is probably more likely than those with more severe symptoms, accounting for the spread healthcare workers. It's not yet clear how long people remain infectious after recovery. It's not clear whether transmission can happen from those who are infected and never show symptoms, asymptomatic cases. But the virus has been detected in throat samples from an asymptomatic case, and in a case cluster in China, the only known source was someone with no symptoms. So yes, this is a possibility. So, the maximum incubation period, 14 days, gives the maximum time of quarantine following exposure. And unlike SARS, transmission can occur before symptoms develop. This means that you cannot rely on screening symptomatic cases to detect all those who may transmit. So, what to do if you want to travel? Here is some advice for you. Firstly, I would say that you should restrain to travel in those parts of the world which are still affected. If the travel is a necessary action to take, then make sure that you follow all the precautions and standard operating procedures during your travel, and cooperate with the travel staff. Before leaving, talk with your doctor and take an advice from the doctor. Also, keep some medicines or some helpful kit in case of any emergency situation. Please kindly avoid traveling if you are currently sick, because this might aggravate the situation as well. Seek immediate health care if you fall sick while traveling, and kindly follow doctor's advice. That's it for today's lecture. Till then, see ya in the next lecture. Remember, stay home, stay safe. Thank you.